Xin chào, tôi là bác sĩ Wade Brackenbury. I'm the owner of the first chiropractic clinic, ACC, in Vietnam. And we have a lot of people calling us up and asking us whether it's okay to come into the clinic with coronavirus. And we have many people still coming in and getting treatment. However, many people are also calling up and saying that they're really worried about going out into the public. And yet they still have back pain, neck pain, and knee pain. So today, what I'd like to do is to create a short video showing 3 exercises for low back problems, neck problems, and knee problems that are safe and effective for almost any kind of condition you might have. As everybody who's ever done yoga knows, when we do downward dog, we start out in the prone position like this. And we gradually put our elbows very close to our sides, and using our hands and our back muscles, we gradually and gently roll up into the full position. And it's super important you keep your head very loose, your neck straight, and you don't use the muscles of your neck to do this. Now, many people who do yoga know how to do this exercise. However, people who have back pain need to be very extra specially careful about how they do it. So as they roll up, you need to start by just simply lifting only the chest and gradually letting each vertebrae come up one at a time. At the point that there's pain, you need to stop and go back down again. And so if you can come up a long ways before there's pain, go as far as you can. If you can only come up a little ways, come up only a little ways. Gradually, you'll increase the range of motion. If you do this exercise carefully, the range of motion in the spine will improve, the pain will decrease, and you will feel an overall improvement in the situation. It has very little chance of doing damage to an existing problem. Second most common reason that people are developing low back problems is because the muscles in the low back become too stiff and weak. And there are many exercises that are effective in strengthening the low back. However, many of these exercises are not appropriate for certain types of back problems. There are a few exercises that are very safe to do for your back, regardless of what problem you might have. And the safest of all is, again, an exercise we modify, but we borrow from yoga and Pilates, and we call it bird dog. In bird dog, we go down on our hands and our knees like this. And anybody who's taken yoga or Pilates knows that you start out by going with one leg out and one hand out and holding it, and then coming back down again. Now, if you can do that, and there's no pain and it's not very difficult, then we add a variation to it. We put one hand out, one leg out, and then we rotate out at a 45-degree angle, come back in again, and then come down. If you do this exercise 20 times on each side of your back, most of the time the back will get stronger and the problem will begin to decrease. A variation of bird dog that makes it much more effective is to take 2 very small weights and to hold them in your hands. So instead of just using the weight of your arm, you use the weight of a dumbbell. And you come out like this, hold, come back in again, and down. Come back out, hold, come back in, and down. With bird dog and with cobra, you should do each day 20 repetitions, and you can do it 2 or 3 times during the day as needed to relieve the pain. The third exercise I'm going to teach you today is a very simple exercise again, and again it's one of 3 exercises that's safe for almost any type of back problem you might have. And this is called simply plank. And everybody again who does cardio training, who does fitness training, who does yoga, probably is familiar with plank. But let me show you how to do it very carefully and precisely so you don't have a high chance of injuring your back. So when doing the plank, the first thing we usually will do is we'll do what's called the semi-plank position. We'll put our arms here and we'll put our legs down. And I'll usually hold that, I'll have the patient hold that for about 1 minute. If they can hold that for 1 minute without any pain, then I would ask them to go to the next stage, which is a full plank. With a full plank, we're going to come up all the way onto our hands and our knees. And full plank is, again, an exercise that strengthens both the stomach and it strengthens the low back. And again, it's safe. It's a safe exercise to do, even if you have a very unstable back problem. Okay? So this is full plank. And you can hold it for between 30 seconds and a minute. Thank you so much for listening to me today and watching these exercises. I hope very much that you'll all take great care not to get sick. Try to be healthy, happy, and take care of your families. If any of you are having any kind of back trouble, feel free to contact ACC. We will help you from a distance if we can. We'll do anything we can to help you. We'll put a phone number here and an email. And if you have some questions or have something you need some specific guidance on, we're very happy to help you with that free of charge. And again, we do feel that it's appropriate to come to the clinic and have treatment at this time. If any of you are having very severe problems and feel worried about coming to ACC, we're taking every precaution to be clean. Thank you so much and have a good day.